Welcome to UMCC, Medical Consultant Connectors, where your health matters to us. Ever found yourself squirming uncomfortably on your seat? This could be more than just a random discomfort. We're lifting the veil on a common but often hushed condition: hemorrhoids. Despite its prevalence, it's typically shrouded in secrecy due to embarrassment. But understanding hemorrhoids, their causes and symptoms, is crucial to your well-being. So let's break the silence and start the conversation about hemorrhoids, because knowledge is the first step towards relief. Stay tuned as we delve into the causes of this common yet often misunderstood condition. So, what causes these pesky hemorrhoids, you might ask? Well, several factors can lead to the formation of these bothersome bumps. One of the most common culprits is straining during bowel movements. When we push too hard, it can lead to increased pressure in the rectum, causing the veins in this area to swell and form hemorrhoids. Another factor is sitting for extended periods. Whether it's at your desk job or during a long flight, prolonged sitting can put pressure on the veins in the lower rectum, again leading to hemorrhoids. Obesity also plays a role, as excess weight can increase rectal vein pressure. And let's not forget about pregnancy. The weight of carrying a baby can cause increased pressure on these veins, and hormonal changes can make your veins more susceptible to swelling. So, there you have it. Understanding the causes is the first step to prevention, but how do you know if you have them? What signs should you look out for? That's the question we're going to tackle in this segment. Hemorrhoids, while common, are often misunderstood, and knowing the symptoms can help you catch them early. Discomfort in the anal area is one of the first signs you might notice. Itching too can be a telltale sign. These symptoms alone can be distressing, but they're often accompanied by pain, particularly during bowel movements. Now let's talk about a symptom that should never be ignored: bleeding. If you notice bright red blood on your toilet paper or in the toilet bowl after a bowel movement, it could be a sign of hemorrhoids. This symptom, while alarming, is a clear signal that it's time to seek medical advice. Remember, early detection can lead to more effective treatment. So listen to your body and don't ignore these red flags. Now, we know the causes and symptoms, but how does one confirm a hemorrhoid diagnosis? We'll explore that in the next segment. How do doctors diagnose hemorrhoids, you might wonder? Well, it's a process that begins with a thorough review of your medical history. Your doctor wants to know about any past issues that might be contributing to your current discomfort. Next comes the physical examination. It's not the most glamorous part of the process, but it's absolutely essential. This step allows your doctor to identify the presence and type of hemorrhoids, internal or external. Remember, while hemorrhoids can certainly be uncomfortable, they're usually not serious. Most people find relief through a combination of lifestyle changes and medical treatments. And here's some good news: the vast majority of hemorrhoid cases can be effectively treated. It's all about finding the right solution for you, which could be as simple as a diet change or as complex as a medical procedure. So, you've been diagnosed with hemorrhoids. Now what? Stay tuned. We have some answers for you in the next segment. Scene script. How can you prevent and treat hemorrhoids? Preventing hemorrhoids often revolves around a few key lifestyle changes. One of the most effective ways to prevent this uncomfortable condition is by maintaining a high-fiber diet. Foods rich in fiber, like fruits, vegetables, and whole grains, can soften your stool and increase its bulk, helping to avoid the straining that can cause hemorrhoids. Drinking plenty of fluids is another important preventative measure. Water and other non-alcoholic beverages can prevent dehydration, which is a common culprit behind hard stools and straining. Now, let's shift gears and talk about treatment options. If you already have hemorrhoids, over-the-counter creams or suppositories may help. These products often contain the active ingredient hydrocortisone, which can reduce inflammation and pain. But what if over-the-counter treatments don't work? If your hemorrhoids are particularly persistent or severe, it's time to consider other options. You may need to make further lifestyle changes, like incorporating more physical activity into your routine, or losing weight if you're overweight. In some cases, medical procedures may be necessary. These can include rubber band ligation, where a band is placed around the base of the hemorrhoid to cut off its blood supply, or surgical removal for more severe cases. Remember, hemorrhoids are common and treatable. Don't suffer in silence. Seek help when you need it. UMCCC, your ultimate medical consultant connectors.